All right, so been getting a couple questions about FAI. What is it? How you test for it, and then how you would train around it. So basically, what FAI is it's femoral acetabular impingement. So as you know, femur comes up and then rides into the hip socket, almost like a ball and socket. Well, it is a ball and socket, but so essentially with FAI, what happens is you have a bony outgrowth. There's two different types. You can either have cam or pincer, and cam is specifically when you get a bony outgrowth on the head of the femur, and then pincer is when you get more of a bony outgrowth on the rim of your acetabulum. So essentially it kind of closes down that rim, makes it a little sharper, and then anytime you're trying to go into flexion, what can happen is you can hit up against the edge of that rim. Same with the bony outgrowth on the femur. It kind of limits the range of motion within the hip, especially in flexion. So again, this isn't necessarily something that's present in everybody, but if you look at the research behind it, for the average athlete, 1 out of every about 3 to 4 guys is going to have this. Now, this can be often misinterpreted as just really matted down soft tissue. There's a couple things you can do to address that I'll get into later, but there's a couple tests that you can use to check for it. And for somebody that's really bad in FAI, you can just pick it up right away. So first thing you can really look at is just called a rock back test. With this, you're just going to start quadruped position. Toes are going to be dug into the ground from here. All we're doing is rocking butt to ankles. Now if you have full range of motion to the point where you can get below 90 degrees, that's essentially a squat for the most part. So all this test is going to look at is, are you getting any rounding in the lumbar spine as you take yourself to 90 degrees and then past 90 degrees. And those with FAI, which I'll include a link in the description, but with those with FAI, I mean, you're going to see bony blocks here just above 90 degrees, at 90 degrees. I mean, you even have some guys that stop right around 45 degrees. And again, the thing to watch for is position of the lumbar. Of course, they can go to 90 degrees or get below parallel, but again, you're going to see that more movement in the lumbar spine and kind of more things through the pelvis. So again, that's the first test. Second test is you can place yourself, ideally you would do this with a manual therapist, but if you have a friend who knows what they're doing, you can put yourself on a flat surface, have the person take yourself into flexion. Again, adduction, so bring the leg towards the midline, and then internally rotate the leg. And again, they would do this passively, but if you get any pain or pinching or anything kind of in the anterior medial portion of the hip, so the front kind of more towards the midline of your body, closer to your groin, if you get any pinching or pain there, it's generally a good indication that there might be some sort of bony block going on there. Again, that could be soft tissue related to tightness in internal rotators and the adductors and things like that. So that kind of gives you a general overview of what you're looking at with FAI. And again, you can kind of do a few other tests on yourself. If you put yourself on a box or something like that, you can easily determine where you're at. I'll just use a chair for simplicity's sake, but essentially if you put yourself on a box and you have your feet up off the ground, you can look at deficits in internal rotation just by taking yourself through that internal rotation and seeing if there's any sizable difference. Now again, my internal rotation is pretty sucky. I'm aware of that, but another thing that you're going to find is if you put yourself through a prone internal rotation test here, have something in between the knees to squeeze, and then take the feet up and take yourself through internal rotation, you should have a good bit of internal rotation. Now again, I'll give you a view from behind so you can get a better idea of what's going on. Again, my internal rotation isn't the best, but you can see that there is a decent amount. Now those with FAI, you're going to see something like this, where I mean they're just barely getting 5 to 10 degrees of internal rotation. Um, and that's worst case scenario. But I've had a few people mention things like I get clicking and popping when I'm really in an external rotated position, whether that be squatting, focusing on shoving the knees out, or shoving the feet out against the lateral edges of your shoes. Anything like that could bring about what you perceive to be as bone-on-bone contact in front of the hips. So again, like I said, it could be FAI, could be soft tissue, but it also can be bone structure of the hip. So we got to remember that the hips could be retroverted, meaning they're actually the head of the femur is actually pointed back in the socket. So you actually have to externally rotate, and the feet will turn out most likely in your everyday stance in order to generate congruency with the head of the femur and the rim of the acetabulum. Same thing with anteversion, where the heads of the femurs are actually rotated out towards the front of your body, and then you actually have to internally rotate in order to get that congruency. So a couple things that you could play with your squat and your deadlift. If sumo feels really crappy on your hips, I know it does for me. I think, just based upon a couple of tests that I've done on myself and what I've noticed in my own training, I think I'm pretty anteverted. And as such, I feel a whole lot better squatting with my toes straight ahead. So instead of focusing on pushing the knees out, I actually just allow the knees to track with the toes, and I can squat with the feet directly straight ahead, which feels pretty good on my hips. I can get to parallel, no issues, and not a whole lot of butt link at the bottom. Same thing, if you're going to pull sumo, I feel really crappy pulling sumo because now I've essentially put myself in an externally rotated position, and now I'm trying to externally rotate harder while pulling up a weight. So now I've lost that congruency, and I'm trying to essentially force myself into a less congruent position. So that's why conventional feels a whole lot better than sumo for me. Again, when I pull conventional, I'll actually turn my toes in just slightly, just a hair, and I feel that. Then when I go down, now I can actually get a tiny bit more external rotation because I'm internally rotating back to that neutral position and can slightly turn out of it. Again, that's what I found works for me. But these are all things to consider when thinking about, do I have FAI? Is it a big deal? And how do I know if it's not just an abnormal development of my hips? This is very, very present in hockey players, just based upon the dynamics of the sport, the way someone skates, contribution of the adductors and whatnot. So it's good to take into consideration what sports you play growing up, what sports you play as a hobby, and basically the biomechanics of how you lift and what your body tells you feels good. So getting back to the soft tissue, again, one of the most neglected parts of the body I find in a lot of people is high hamstring glute tiein. And this is something that gets hit pretty hard, but people don't really know how to address it or how to kind of get into that area. So if you just got a rumble roller, no lacrosse ball or anything like that, you can take it up into that high hamstring area. And I find if you just roll up and down, you don't really get as good of a tissue response if you actually go kind of across the grain, so to speak, and you kind of mash back and forth. Starrett uses a lot of this in his Supple Leopard book, but essentially you're just looking to bias the tissue in a different way than you already have. Now, the real fun starts when you can start using a lacrosse ball, and I like to do this on a box. You could do it on any sort of wooden or cement surface, like a ledge or anything that's high enough where essentially your feet are off the end of it. But essentially you're going to take that ball, put it just below, right on the edge of your glute, and you'll find that hamstring tie-in really quick, as it's very, very tight in a lot of people. But again, you can move the body, and again, your feet should be off the ground. You can move the body and try and find some stuff that's knotted up in there, and then you can move the legs. So bias yourself through extension and flexion, and then you can also take yourself through internal and external rotation. So that's kind of a good piece that a lot of people neglect, and is very, very knotted up from a lot of deadlifting and squatting and whatnot. Again, you can just hit your typical foam roll on your adductors, bring the leg up to 90 degrees, roll into the groin, you straighten the leg. You can also try this putting the foam roller up on a box and elevate it a little bit, and you can get a little more pressure into the foam roller, and you don't get as much restriction from the floor. So that's a few things that I would try and work towards. The hips may also feel kind of weird or funky because anytime you squat or deadlift, you also have to remember that the head of the femur, when you go into flexion, must glide posteriorly in the socket. If it can't and it's stuck, then as you go to glide, you're actually going to hit the rim of the acetabulum. So if you're sitting a lot, if you're a student doing things like that, anytime we're in this position, essentially what's happening to the hip joint. The femur is getting compressed up into the hip and is actually getting shoved forward in the socket. So over time, that's obviously going to play a very big role in your squatting and your deadlifting mechanics. Now, if you've only been sitting for, well, you've probably been sitting since you were a little kid because you were in school and you were sitting, but if you're on your feet a lot, then hopefully that would help to keep that joint in neutral. But if not, and you get a lot of pinching in your hip flexors when you squat, you get a lot of tightness and binding in the front of the hip, and you can't seem to get to depth, or you always butt wink in the bottom, then it's time to perhaps look into mobilizing the posterior capsule and getting that femur farther back into the acetabulum. Simple. You start quadruped position. Again, we're going to extend the leg that we're not mobilizing behind us, shift all of our weight onto the leg we are mobilizing, and then the way to make it even better is we can drop down on this elbow, and now essentially we've biased all of our weight into our left hip. You want to feel like you're driving the femur out the top, near glute med, kind of right here, top of the hip. Again, you can bias external rotation. That may not feel good. This doesn't feel good in external rotation for me. However, internal rotation feels a whole heck of a lot better. Another reason why I think I'm slightly anteverted. You can add a band around the hip and distract it posteriorly into a rack, and that's something that will really stretch out the back of that hip capsule. Again, don't be too aggressive, but you just kind of want to work around those tissues, oscillate a little bit in and out of different positions, see what really feels good, and see again what your body responds to. You'll notice that I get some movement in my lumbar spine, and not as much out of my hip capsule, so obviously I still need to do a little bit of work on this posterior capsule. But again, just some things to try out, some things to think about, especially when you're doing stretches. I don't like to do a whole lot of, you'll see guys doing the rocking frog stretch here to kind of open up the adductor and whatnot. That doesn't feel good on my hips. I feel like I get some bone on bone right near where the hip joint ties in, and a lot of other things which put me in external rotation just don't really feel that good for my hips. So that's some things to think about, things to consider. FAI isn't always the problem, but like I said, 1 in 4, 1 in 3 guys is probably going to have some sort of variation. Now, is it always full-blown? Will it require surgery? No. But it is something to be aware of, and if your hips are always feeling kind of weird, it might be worth an x-ray just to see. So anyways, hope that was informative, helpful, gives you some things to try out. Let me know how it goes.